y'all, welcome back to the area. My name is Samia Taylor. I am Capital Area Human Services Social Media Director, and it is the month of April, which is
STD Awareness Month.
All right, y'all, so we'll be having a conversation about sex and how it correlates to substance abuse and mental health. So we have a very special guest today. Her name is Sashika Baunchand, and you gotta say it like that. Baunchand. It's French. All right, Sashika, so tell them about what you do, where you're from, what you got going on.
So I am the founder and executive director of Outstanding Mature Girls Organization. It's a youth organization in Louisiana. Our home base here is here in Baton Rouge. We educate our girls about HIV AIDS and all other health-related fields. We also teach them humanitarian leadership, life skills, and value. So, and also, aside from that, they call me your favorite AHF advocate. I am the mobilizer for the entire state of Louisiana for the AIDS Healthcare Foundation. So I'll go around building partnerships and also doing STD education in schools or businesses, wherever I'm needed.
So I really like your shirt. Can you tell us what's going on? Tell me about it.
Yeah, so the campaign that the AIDS Healthcare Foundation is running, Racism is a Public Health Issue, just want to talk about health equity and amongst brown and black people. And so we want to make sure that everyone has access to health care, everyone has access to medications, doctors, and all kinds of treatment. And especially right now with, the vaccination going on, we want to make sure that everyone has access. For those who are wanting to get vaccinated, that they have access to the health care. And even people who are HIV positive, just making sure that they have access to medications because it's really expensive.
Yes.
And so, we don't want to take away, medication from people who cannot afford it. And so, hence, racism is a public health issue, not, putting treatment over here, but having treatment over here for someone else that's not black or brown. And so that's our campaign that we are running, just making sure that health equity for all,
Yes.
and
for all is the key
yes.
word, for all.
Mm-hmm.
Love that. So why did you become so passionate about HIV and AIDS and letting people know what the importance is of these diseases?
So with my background being in radio broadcasting, I was a radio professional for over several decades, and I figured that I can use that particular platform to talk about HIV and AIDS, talk about STDs, talk about sexual health, and people will listen. Of course, and it helps breaks the stigma too, because people are like, wait, she's talking about it? Hold up. We need to go ahead and check ourselves and see what's up with that, HIV education and STD education. So, that's what it was, just pretty much using my platform in radio broadcasting to be able to do that.
So is there a direct correlation with HIV and AIDS and mental health? Is there something that kind of
Yes, definitely. When someone finds out their diagnosis, it will play a toll on your mental health. You go through the process of, some people go through the process of wanting to take their lives. Family members don't talk to them, so they feel isolated. Just a lot of thoughts run through their heads of who gave it to me, because some people may not know, some do know. And just, so it plays on your mental health until you get to a point to where you seek out programs, seek out groups, and you start to build up a healthy mentality when it comes to that. And sometimes, we have a lot of people turn into advocates. So, yeah.
So tell me a little bit more about tell me a little bit more about mental health, like what they can do to overcome these situations that are in when they are been diagnosed with HIV or AIDS or even a regular STD.
So I know I can't speak for myself, but just for my friends who are HIV positive and hearing them tell their stories, it took them quite some time. Some of them did turn to substance abuse in the process, and they finally had an aha moment. Now, the aha moment didn't come like a month later or a day. No, it came several years later, after realizing that, you know what, I have a purpose, and my purpose is to educate others on slowing the spread or stopping the spread of HIV. So just hearing their stories about how they overcame, that whole mental process, and being able to, because they always say that when you dive into helping other people, it kind of helps you forget about your problems and your issues. And so I feel that's what most of my friends have done. Now, there are some who are still dealing with that process and of their diagnosis. And hopefully, one day they're able to help others and realize that there is a purpose in their pain. I don't want to call it pain, but just a purpose, in their diagnosis.
Yeah,
So.
absolutely. And you mentioned that some have turned to substance abuse. So
Mm-hmm.
tell me a little bit more about that. Like, what have you seen in working in this field about substance abuse? Is it people are using alcohol, or are they using other
Everything to numb the pain of finding out that they are HIV positive. Everything to numb the pain of family, friends turning on them, from alcohol to needles, just pretty much everything I've heard, from my friends that they've done and pretty much at this point have turned away from.
Oh, that's good. So here at Capital Area, we offer a lot of services. Do you recommend services
Yes.
to others, that like therapy or counseling group sessions or anything like that?
Yes, I always say that every successful person has a therapist.
That's
Every
true.
successful
That's true.
person has a therapist. In order for you to navigate through this thing called life and navigate through the situations that may have, distracted you in the past, it's good to seek out help from a professional. Don't try to take this out on your own. Don't try to, because don't say, you know what, I can go cold turkey and I can do this. No, there are resources out there like you all and just many others that you can turn to for help. Don't try to do this on your own.
Okay, y'all heard her, right? So I know you really focus on HIV and AIDS, but tell us a little bit more about like other STDs or what you can do to prevent them, or how easily spread they are.
So being that it is STD Awareness Month, we have had the opportunity, and I say we, our young girls in OMG had the opportunity the other day to actually talk with the Department of Health on, just having a chat, youth just talking about it. And so, the STDs that they were talking about, and, the Department of Health was really impressed. They talked about trick, they talked about herpes, gonorrhea, chlamydia. And one thing that I realized that they forgot to mention was syphilis. Syphilis is definitely on the horizon. And another one they did mention was hepatitis. And so hepatitis C is commonly known in intravenous drug use.
Okay.
IDUs, that's what y'all call it? Did I get it right?
Yeah,
Okay.
you got it.
So they mentioned hepatitis, but they forgot syphilis. And we have to understand and know that syphilis is not just with the Tuskegee experiment. Syphilis is real.
Okay.
And if you don't get treatment early, it can lead to blindness, hair loss, just a lot of things can definitely go wrong with your body. And of course, death can be one if syphilis is left untreated. But if you find out early, get tested, you can definitely get the medication to help treat it, along with the other STDs. Now, the only one that does not go away, of course, is Do you know?
HIV and AIDS.
HIV, AIDS, and herpes. Herpes, you can treat it. You can treat HIV and you can treat HIV. You can treat herpes, but it does not go away. Now, AIDS, it is two separate things. HIV, AIDS are two separate things. So AIDS is the final stages of HIV.
Okay.
So when someone, a friend of mine, he was diagnosed with the AIDS diagnosis because when he was just going through those things in his life, he didn't go and get treatment, and he didn't. He said at that point he didn't care, and he was given like a few months to live, pretty much.
Oh, wow.
And that's whenever he had the wake up call of, you know what, I want to live, and he's living healthy and strong to this day. But not many people come back from AIDS.
Okay.
You know, because like I said, AIDS is the final stages of HIV. When you don't get treatment, when you don't take your medications as you're supposed to, you can die. You can die from it. But sometimes it doesn't show up, you know, as AIDS. It'll show up as pneumonia. You know, it'll show up as something else. So anything that would normally, you know, somebody can normally bounce back from at times can kill you. And so, you know, it's just something that we have to, you know, be mindful of.
Yeah. So you said that HIV/AIDS is a treatable thing, and I feel like a lot of people don't think that that is possible. You know, I feel like for a long time it was just like, once you get HIV, you get AIDS. But correct me if I'm wrong, but that is treatable to the point where it's almost like, not that you don't have it, but it's not going to detect. So tell a little bit more about that. I just want to let the people know that it is going to be treated, but we want to, you know, of course, prevent getting it at all. But
definitely, you can live a healthy life with HIV. You have to make sure that you take your medications every single day so you can suppress your viral loads. Make sure you go into treatment. I know with COVID, we had a lot of people fall out of treatment, and I don't know if you all had the same thing here, but just a lot of people, you know, fell out of treatment. And our goal for this year, and our goal ever since, is to make sure that we get people into treatment so your viral loads can be suppressed. And for those who want to start a family, you can do so living with HIV. You have to make sure that your viral loads are suppressed and your partner is on PrEP. And so your partner who may be HIV negative gets on PrEP, and there's something that they have to take every single day, pretty much, you know, for the rest of their lives. Just like birth control pills, you cannot miss a day of taking your medication to help, you know, make you feel better. Because when you miss a day of, you kind of, it's not as effective when you miss, you know, your birth control pills. So, so just like with any other medication, you miss it, it's not as effective. So you can definitely live a healthy life with HIV and AIDS as long as you're taking your medicine and as long as you're getting treatment for it. You can suppress those viral loads to where, like you said, they don't show up in your blood work.
So is PrEP like a preventative type thing?
Yes. So PrEP is a preventative pill that you take once a day to be able to stop this. Sorry, I just burped. You gonna cut that? Okay, I'm gonna start back. So PrEP is a preventative pill that you take once a day to stop the spread of HIV. Now we have to keep in mind that when you take PrEP and you know, you're not thinking about family planning or anything like that, you should use a condom to prevent other STDs.
You should always use a condom.
Yes.
Wrap it up. Okay.
Yes. To prevent other STDs. Now you're stopping, you know, you're preventing HIV, but you have to understand there's everything else out there that you can get if you don't protect yourself with a condom while using PrEP.
Gotcha. So I have also heard about like the numbers in Baton Rouge are, you know, we're pretty high.
Yes.
But we want to know what they've been coming down, right? So tell us about that, what we've been doing good?
So before the pandemic, we have been getting people tested, getting people into treatment, doing everything possible to make sure that we slow the spread, stop the spread of HIV. And it had definitely worked to where, we were way up on the scale. And don't get me wrong, we're not too far from the top still, but we, have kind of went down a little bit lower.
Yeah.
We're not all the way up at the top
Good.
anymore. So but we have to continue to go into treatment and eliminate that stigma, because a lot of people are afraid to go and get tested. A lot of people are afraid to walk into those particular clinics to get any help. And even with behavioral clinics, people are afraid, that stigma that people have, like, oh, I'm walking in here, people are going to think this, think that. So we have to, break that stigma, get treatment, and be there for someone, be there for your friend or whomever that may have received that diagnosis of HIV. Be there for them. Be there for your friend who may have received that diagnosis of just an STD.
Yeah.
And let them know, look, hey, take your medicine. Don't go back with that person.
Right.
Have that person go get tested as well, and so forth and so forth. So, just be that support system.
So how often do you recommend, like, a sexually active person get tested for regular STDs, HIV, AIDS, any of that? How often should we be seeing a doctor?
Every 3 to 6 months.
Okay.
If you are, just living it up, definitely, get tested on the regular, and make sure that you are an advocate for your health when you go in with your doctor, and just let them know, be honest with them. And let them know, hey, don't just test me for HIV, but test me for, other things, other STDs, or don't just test me for STDs, but test me for HIV. So, just be that advocate for yourself. I know now, even with expecting moms, they do HIV testing automatically. So if your doctor does not do that with you, you need to make sure, and if you're expecting mom, make sure that they do so.
Awesome. So from my understanding, I hear that you host a conference every year called the OMG conference. So tell me a little bit more about that. Like, what do you guys do?
Yes.
What's going on?
So the OMG conference is youth conference, and the conference started off as a HIV AIDS education conference. And I say it started off, but it still is that conference. And so with my background in radio broadcasting, we kind of mix education and entertainment all together to where the girls are being entertained but educated all at the same time. And and they walk away with just gems, dropped by our guests, and just all the information they learn, leadership skills, they learn entrepreneurship, they learn how to take care of their overall health with healthy eating. They learn about coping with loss, rejection, bullying, things of that nature. So mental health is a big factor. They learn about loving themselves, loving their lives, loving their looks. We talk about it all. So it's a conference for girls ages 10 to 19 years old. You can go to omgyouthconference.com and register. Right now, the first 300 girls who register, they are going to get some free swag. So right now would be the opportunity to do so. So that's omgyouthconference.com. Girls ages 10 to 19. It's going to be hype. It's a conference that you do not want to miss. You have to be there to see it.
When is it?
It's May 29th.
Oh,
May
okay.
29th.
Right around the corner, y'all. So get y'all's tickets. Y'all
Yes.
know what she said.
May 29th at 10 a.m. We're going virtual, and we're going to have some girls in person, hybrid, socially distanced, of course.
Perfect. So we're going to wrap this up. So let us know top 3 things. What do we need to do to prevent STDs? Okay. What do we need to do to get ourselves together? Keep it right. Keep it tight.
Get tested is number 1. Get tested is number 2, and get tested is number 3. Get tested. If anything that comes out of STD Awareness Month is get yourself tested. GYT. Get yourself tested.
Somewhat. Period. Okay. So thank you so much for being here. I really appreciate it. This is a conversation that needs to be had. People are I think it's such a taboo topic, but we're all grown adults here. So if you are doing it, you need to be able to be an adult and
be accountable
and get tested. Okay.
Strap up.
Thank y'all so much for tuning in. Make sure you tune in next month. We will be back here in the area.